Hello, my name is Chris, and today I'll be presenting my research to answer my clinical question if active release technique affects the range of motion of the glenohumeral joint. My PICO question is, does ART increase the range of motion of the shoulder joint post-injury in collegiate athletes? Notice that there is no comparison in my PICO question. However, as you will see, my article chosen did compare two manual mobilizations that related to ART but were not entirely the same. In finding my article, I used the Medline database. I input keywords like manual mobilization, shoulder, and range of motion to ensure I found articles relating to my PICO question. After finding general articles close to my PICO question, I did a more advanced search with criteria such as only randomized control trials, and I ranged from the years 2000 to 2018 so I could find the most recent studies done about my topic. The article I found was a randomized control trial done in Spain from March to December of 2016, which evaluated the immediate effects of MWM compared to sham technique on various outcomes. This randomized control trial was a level 1B, as it was an individual randomized control trial with a narrow confidence interval in a single population, but did lack a follow-up period. The sample size was 27 participants, which were then divided into two groups. Group 1 had 14 participants who received MWM treatment for the first 4 sessions, then sham technique for the last 4 sessions. Group 2 had 13 participants who received the opposite treatment order of Group 1. For the parameters of the modality, the patient remained in the same position for the whole study, sitting in a chair with the trunk supported, feet flat on the floor, and hips and knees at 90 degrees. For the MWM treatment, the patient was familiarized with the technique before it being administered. The therapist positioned one hand flat on the scapula and placed the other hand on the anterior surface of the humeral head. He then applied a dorsolateral glide force to the humeral head, and the patient was asked to raise their arm in the scapular plane around 30 degrees per second until the onset of pain occurred. The therapist supported the glide of the humerus throughout the entire duration. 3 sets of 10 reps for each session were conducted with 30 seconds rest in between each set. For the sham technique, this replicated the treatment of the MWN but had different hand positioning. The therapist positioned one hand on the clavicle and sternum and the other hand on the posterior face of the humeral head. Anterior gliding motion with minimal force was conducted. The patient was asked then to elevate the shoulder in the scapular plane until the onset of pain, and it was done under the same set and rep scheme as the MWN treatment. This study used a universal goniometer with a precision of plus or minus 2 degrees to measure shoulder range of motion of external rotation, abduction, scapation, and flexion with a minimal detectable difference based on a 90% confidence interval. They also used SPATI, which consists of 13 items divided into 2 subscales, pain, which is 5 items, and dysfunction, which is 8 items, with each item scored from 0 to 10 points. The final score of the questionnaire ranges from 0 to 100 points, with higher scores indicating greater shoulder dysfunction. 2 techniques in this study are both derivatives of the joint mobilizations we did in lab. The results from the study and the results from our experience in lab both increase the range of motion by a couple degrees. This article did not answer my PICO question as it had nothing to do with ART. However, I could use the results of the study to support my PICO question. The article's conclusion that neither MWM nor sham technique really had an immediate effect on the range of motion but did decrease some pain could support that ART would be a better manual therapy than just joint mobilizations. Personally, I have experienced ART and would recommend it to anyone with a joint injury as I felt better immediately after treatment. Specifically with my shoulder, I felt better after 1 session of ART than I did with 1 session of just joint mobs. Thank you, and this concludes my presentation.